in Salem, Winchester, and Campion. That is, demand for the booster has died down.
Emily or Bob, did one of you want to do some introductions, or?
I can start if you like, Bob. It's up to you.
Sure, Tom, why don't you go ahead? That would be great.
Finding common ground, talking about climate change, and it's Howard Dean. Medical one, but I don't think it'll be too medical.
Hello, everyone. This is State Senator, Dr. and erstwhile father, husband, Tom Sherman. I would like to welcome you all to this webinar. This is, everyone does have access to this, so I would ask ahead of time if everyone could mute your access to make sure that there's no feedback or background problems. I just wanted to welcome you all to this discussion of communications and leadership and how to communicate in the area of health and climate. And we are so excited tonight. I am part of the advisory board for Healthcare Workers for Climate Action. I would like to recognize our founder and fearless leader, Bob Friedlander, and we'll get started. So with us tonight, we have Governor Howard Dean. He retired from his family medicine practice to assume the office of the governor of Vermont, a role in which he then served for another 5 two-year terms. His career-long commitment to climate and health issues from various positions of leadership and expertise is well documented. Also, we have Dr. Rob Gould, who is a senior public health communication strategist, who is part of the senior leadership team for the Medical Society Consortium on Climate and Health based at George Mason University. We also have Polly Campion, very well known throughout the state for her work. She is a former New Hampshire state representative and was on the House Health, Human Services, and Elderly Affairs Committee. She's a retired RN. She chairs the New Hampshire State Commission on Aging and has been a long-term New Hampshire resident. Representative Bill Marsh, also a retired ophthalmologist, a hospital trustee, town health officer, and a state representative. He has vocally advocated for public health and recently became a Democrat. Gastroenterologist, former New Hampshire state rep, current New Hampshire state senator for District 24. I also served as chair for the Ad Hoc Commission on Emissions, otherwise known as the Emissions Commission. So let's get started. And Governor Dean, if you wouldn't mind giving us a few words to start out the evening.
Senator, thank you very much, Senator, Dr. Senator. So I'm going to talk, I'm actually not going to talk a lot about politics in the sense that we normally talk about it, which is the conflict between the parties, the conflict between people who want to be disbelievers in climate change because of all sorts of other emotional issues that have actually nothing to do with the subject. And put on our doctor's hat a little bit, or perhaps even our social work hat. Activists are unbelievably useful. And we need activists, and I'm not talking about me or some of the political people here. I'm talking about people who are out protesting, who are telling the truth as it needs to be told. But activism is also incredibly polarizing, particularly at this incredibly polarizing time. So for those of us that are wearing political hats, we have to be able to find a way to talk to people so they can hear us. And now physicians in the office have a huge example, a huge advantage. And this is also, of course, in fact, and I might argue that nurses actually and other professionals might do better even than physicians, because the relationships are not exactly the same. Who are people going to listen to? They're going to listen to somebody who's as unthreatening as they can possibly be. That's how they're going to change their minds, or that's how they're going to allow themselves to be educated. The biggest problem we have right now in this country, and I'm not going to dissect all the reasons why. I think everybody on this Zoom knows why. But there are people who intentionally believe things that they should know are not true. And it's poisoned our political dialogue, but it's also poisoning our ability to do something about climate change. I was thinking about this morning because of the explosion off in the ocean off Tonga. And, you know, in some ways, while we are threatened with the loss of our democracy in the country, and that's a very serious problem, that can be reversed. I'm pretty optimistic that that Omicron is going to be certainly not eliminated, but consigned to most likely a winter flu type thing where we can all get vaccinated on whatever the strain happens to be that year, and we're going to live with this, and it's going to become endemic, and we're going to be able to control it. The problem with climate change is there's a tipping point, and it's going to be incredibly hard to survive once we get by the tipping point. There was a really interesting article. I'm embarrassed to say, get all my news on Twitter, because I find it just incredibly tedious to read some of the longer opinion pieces that are disguised as journalism these days. But there was a really interesting piece in Vermont, which showed that we are now, and this most likely is true of New Hampshire as well, we are now a destination for climate refugees. We saw the largest increase in population in the last 10 years that we've seen in any census for 100 years. And it is people coming from parts of the country that are, I think it'd be dramatic to say no longer habitable, but they are the frequency of really disastrous occurrences, mostly storms and floods and things like that, have made it pretty frightening for an awful lot of people. And the people we're getting, of course, are the people we always wanted, which are upscale, well-educated people who have the ability to move. And there are a lot of people who don't have the ability to move, the financial ability to move. Often they don't have the skills to be able to freely take jobs all over the place. And New England, especially Northern New England, is really a haven for people like that. So that is penetrating people's consciousness. There's some polls that I get probably 2 or 3 times a week. Some of you probably do too. A guy who runs an outfit called Navigator, and he does interesting polls on subjects that Democrats care about, although they're not particularly partisan polls. Climate change is finally seeping into the consciousness of a very large number of Americans. There's very little agreement about what to do with it, with the information, and we can provide that information. But when we were talking about prepping for this, I think that there was a pretty big consensus that we really need to speak to each other in ways that we can hear each other. That speaking from in a campaign is difficult because it's a divisive enterprise. Speaking in the legislature is difficult. The relationships in the legislature don't need to be difficult. I know they happen to be right now because I know what your legislature's like. But they don't need to be difficult because you do develop personal relationships with people. And that's really going to be the secret of this messaging. It's not going to be done by ads. It is going to be done in some ways by shock through the news media when horrible natural catastrophes take place as a result of climate change and what we've done to the climate for the last 300 years. But the solution is going to be quiet discussions that are not involved in political campaigns. That doesn't mean political campaigns and activism is not necessary. It is necessary. Otherwise, the subject doesn't come up. But when we, especially in the medical profession, or when we, as policy-oriented people, talk about it quietly, that's how you change minds. you have to get people into a position where they can think about changing their mind. And it's not easy to do in this incredibly polarized atmosphere. I know there's going to be some discussion later of a lot of really interesting research that shows how we can talk to people. So I'm going to stop there and thank you all very much. This is incredibly important to do this. And there's a lot of talk about, oh, our lives are at stake and our future is at stake. Well, our future is at stake, and it's not just us, and it's not just the United States. The interesting thing about this is, as in the pandemic, and this may be one good thing that comes out of the pandemic, there may be a realization that we really are all in this together, whether we're in China, Africa, or the United States, and that if we don't all pull together, or the famous revolutionary saying is, if we don't hang together, we'll assuredly hang separately, and that's really true. We are all in this together. The pandemic has made that very clear. I don't think we've learned the lesson. I certainly don't think the policymakers have learned the lesson, but I think it is starting to get people to think that we have the same problem, even in countries where we have a lot of friction, even other areas of our own country where there's a lot of friction. I mean, if you were a Texan or from Louisiana, I think you'd pretty well recognize how serious climate change is, and you wouldn't have to be told about it. So it's all about letting people hear us by not getting in their face or preaching to them, but by seeing where they want to go with this and then guiding how you want to go there. Really not that different than what a really good general practitioner does or a nurse practitioner does when they have a patient that may be a little non-compliant. You can't just hit them over the head, because you all know from experience they're not going to be any more compliant if you do. You have to let them come to the conclusion with a lot of help from you, and get them to be more helpful with their own health. So I'll stop there, and thank you guys again all for organizing this.
Thank you, Governor. Really appreciate those words of wisdom and that perspective. Next, I first of all want to put out a public service announcement. Please mute your microphones so that the speakers can be heard by everyone. And also, if you have any questions, please put them in the chat so that we can discuss them afterwards among the panelists. And next, Dr. Rob Gould will share with us some of the the really exciting research that they've been doing on this exact issue of messaging the importance of understanding climate change from a health perspective. Rob?
Yes, hi. Let me do a little brief introduction. I've been working for the past 5 years since its founding with the Medical Society Consortium, which I think people on the call are somewhat familiar with, and if not, it is an organization initially founded by, I think, 8 medical societies to amplify and mobilize the voice of health on climate. And it has grown over the last 5 years tremendously. It now has 39 member societies, and it has dozens of affiliated partners. But it also has, and what we're absolutely very, very proud of, is a burgeoning number of state-level network affiliates like yourselves. And this is a tremendously exciting time for us to have your activism supporting policy change. And one of the other things that I need you, as a preface, I need you to be aware of is that we're housed at the Center for Climate Change Communication, and I see that Dr. Maibach is with me, and I'll flatter him to his face by saying this center has been a tremendous partner to all friends of climate activism. In the research that they provide, and also to the programs they run, including ours, that they support, including ours. And one of the great things about ED's organization is the research that they do to make sure that we're not only talking about what the evidence is related to climate and health, but we're speaking with evidence-based communication messaging on what's happening with climate and health. And it's just been, and that's what I'm going to be talking to you about tonight. So Ed will be able to correct all the mistakes I make when I do this presentation, which I'm about to start. But I will say, just as to let you know, I was introduced as Dr. Dr. Gould, and I just want to make sure, as my mother often told me, I'm not a real doctor. Okay, I'm a social psychologist. Just want to make sure you know that. Now I'm going to try to share my screen and oops, could someone could the host enable my screen sharing so I can show my slides and you don't have to look at my my face anymore. You can look at the slides. So let's see, it worked. Here it is. Okay, let me see. Okay, is that showing up for people?
Looks good, Rob.
Okay, great. Okay, so we've titled this Climate and Health is a Winning Message for Health Professionals and Public Officials, the latest research. And now I think I wanted to change that, but it's too late now. So let me see if I got the, okay, now I can't advance my slides. Okay, maybe this one will work. Yeah. The first thing I want to say is Governor Dean was absolutely right in saying what a polarized communication environment we live in right now, including climate change. But there is good news to share as well, and that we are the people that are listening to this are very special people because we are going to be able to help communicate both the public officials and the public about climate change in a way that is novel, engaging, and importantly, depolarizing, meaning that our research is showing, and this is our overall finding, that depolarizing means that it works for people across the political spectrum. And as you'd expect, most people who identify as liberals or Democrats are alarmed about climate change. They're on board. There are very few people who are actually dismissive of climate change, but there are a lot of people in between. And many of those people are not as responsive to messages about climate from quote unquote environmentalists, but they are responsive to people who are talking to them about climate as a health issue. So let me go into some overall findings from changes in public opinion over the last decade or so. At this point, the number of people who believe they are being harmed right now by climate change has, as you can see from this chart, for the first time jumped over the midpoint. We have over half of the population. So that's a pretty substantial change and means that the majority of the public is aware that climate change is harming them now. This more detailed chart shows even more dramatic change when we ask people about the specific harms that they, whether they believe global warming is going to harm human health, and whether these harms are going to become more common. If you look at the green bar on all of these various health harms, you'll see that green bar is now, for the most part, either well over or at the 50% mark. But only 6 years before, this is April 2020, I'm sure these numbers are still going in the upper direction. But only 6 years ago, they were not even close to that. So I'm sure that intuitively, we all know that there's one research report that showed that 40% of Americans live in counties that have been struck by climate disasters. So it's really no surprise that it's not just our ability to communicate about the issue, but the actual lived experience that people are having that's changing their openness to the idea that climate change is not an abstract issue. It's not just a science issue. And it's an issue that's brought home to them. It's a kitchen table issue. It's something about health and safety. I think my screen, I'm not getting to go forward anymore.
I'm not sure it's getting there quick enough.
Here we go. Nope. Okay, that's a first. Okay, let me get out of this. And I will try to go back in and see if that works. Okay. Okay.
Rob, maybe you can work off of that screen if it allows you to click on the next slide.
Yep, that's what I'm going to try to do.
That's what I do too.
Okay. Here's another example of authentic selves trying to figure out what to do. So I hope this works for folks and you can just get this done. So look at that as a preface of just, that's the overview of how public opinion is now changing in a way that shows how open the public is to talking about climate as a health issue and how this is changing them. Ed and his team did some message testing research, which we consider extremely exciting, in that it showed when we tested a whole bunch of messages describing the health impacts of climate and to see whether or not these health impacts spurred advocacy, like willingness to call their congressman to do something about it. We tested messages on health impacts. We also tested messages on the health benefits of climate solutions. And we also tested various kinds of calls to action. And we tested them against each other, not just individually, but not only health impacts versus other health impacts, but also what would be more effective, to talk about the health impacts and the harms, or to talk about the health benefits of solutions, or in combination. So here's what we found out. Number one, we found out that talking about the health impacts of climate change, and we had myriad health impacts, not just the ones that you're looking at on this screen, but just to highlight the three that seem to be the most energizing for advocacy were to talk, as you can read these statements, about poor air quality impacts of climate change, about its impact through high water temperatures and flooding that can cause foodborne disease, and the impact on health and safety of extreme weather. So these were the most powerful impacts on advocacy. When we mentioned health benefits, again, many health benefits spurred advocacy, but the three benefits and the most compelling ones to spur advocacy were clean energy, using cleaner forms of energy, as you see, and that would deliver cleaner air and water and reduce pollution, the greening of our communities and cities, and its impact on consumption, that encouraging recycling and other reusing materials, clean air and water, reduce waste, we reduce pollution. If we changed our consumption, and policies helped us do that. All of these messages were effective in spurring advocacy. But what was most important, are you still seeing it? Is everyone still seeing these, I hope? What's most important is that,
Excuse me, Rob, we're not
not
seeing, you need to click on each of the slides on the left side of your screen. They're not expanding as we're looking at it.
oh, you didn't see that? Did you not see this one? Do you not see the most compelling messages to spur advocacy includes?
No, we don't.
Oh, boy.
Rob, you need to click on the left side of
I
your
did.
screen.
I am clicking on the left side.
Try clicking on the slideshow at the top.
He can't advance, I think, is the problem, which seems to be an internal. Were you able to send your slideshow, Rob, to anyone?
Yes, I sent it to Tom and Bob.
Bob Friedlander?
Yeah.
Bob, are you able to pull up the slides or even send them to Emily or I? Because it looks to me like you're trying everything in my bag of tricks, that this occasionally does happen. And usually, just like the former speaker said, you can click on the left, and that's sort of the backup plan where it will, if you double click on like slide 2, it should show that on our screen, but it doesn't
Yeah,
appear that it's
it's,
letting
it's,
me.
I am
Yeah,
double clicking,
yeah.
and, is anything showing up now?
It's
Just
that
by,
same slide, that the one with a bar graph that we keep seeing.
Ugh. Okay. Well, I'm going to rely on you to do this. I'm not too far away from the end here, and I will keep talking and then
I will
review.
put my email in the chat if anyone who has the slides wants to try sending them to me. But if you're almost at the end, it might be more, you can sometimes just summarize.
You
the
just
whole thing.
effectively changed your slides.
I
You
did.
did. Yes.
Okay, you're seeing a different slide now?
Yes,
Yeah.
3 components of effective messages.
Yeah, oh my God, I don't know why that worked, but I'll take it as joy and happiness. So the research showed that and this is the payoff slide, is that the most effective way to communicate about climate as a health issue is to combine a health impact as I've described. Here's the impact of climate change on health, and pick the one that you're the most familiar with or the ones that are most effective, and then say that's harming our health. But the good news is that climate solutions, and you can talk about even particular climate solutions, offer immediate and often localized health benefits. That combined with a call to action to say, we need to do something about this. We encourage you to call your member of Congress or call your state senator or, or whoever the public official is, and include, and the most effective way to do this is to say, the reason for the call is to say many Americans agree and are taking action, to say, if you want people to call, make them feel like they're part of a growing group. It's a popular thing to do. That's called a positive descriptive norm. Many Americans agree and are taking action. Will you join us? So this is a great formula for advocacy, and a couple of things to note. Okay, in this is that, you can talk about the messages, independently. They will be effective and have an appeal. The most effective is to combine the two, but also know that if you're stuck inside, what am I going to talk about? I have one thing to say. The most important thing turns out to be to talk about solutions. That's what people are most interested in, and it's the most energizing of their own advocacy, is to talk about how climate solutions are going to benefit health. And I guess that fits with the idea that it's not just about global, it's right here where you live. Our lives, our health and safety is going to get better. And the other thing is, we almost started this discussion, is that healthcare professionals, not just primary care physicians, but that was just used in the research, but other research shows that primary care physicians are seen as the most trusted sources of information about climate change. So that's very important. As Governor Dean said, people listen to people they trust. And that's the people they want to hear from. We're in a unique position, either when we're talking to public officials, to encourage them to embrace this frame for talking about climate change. They say this is a winning idea. It will help you connect with people. We were able to show them this evidence that it will. And you say, stand with us. And standing with healthcare professionals is a great idea for public officials. And the other thing is, I started this discussion with, is to say that there's little difference in response to this in this research based on demographics, including party affiliation. So this was actually the draft slides that Ed, gave me some input on. And when I want to finish up this part of the discussion on the research before we move on, is to say that we have 3 very powerful messages within the health frame. One is that when we're talking about the harms, we're talking about health impacts of climate change. Again, we're not talking about some abstract issue. We're talking about harms that people are already experiencing themselves or that they'll be able to relate to. And that's when we say the reality of climate change is in our patients, our communities, and our practices. It's very compelling. The second is when we're talking about the benefits, we're not talking about just the fact that we're going to stop climate change and all the impacts it's going to have 50 years from now, which is of course true, but we're going to talk about benefits to health and safety that are going to occur right away and here where we're talking. So that's a unique and compelling thing to say. And the last thing is when we're talking about people who oppose change, we are going to not just say that they're trying to help stop progress and it's not the dramatic changes we need to make. We're not saying they're not helping us stop climate change. We're saying these people are not looking out and not putting a priority on our health and safety. So those three things are all extremely powerful and unique to the health voice. So I'm going to stop there, and I'm sorry that this was a bit of a haphazard visual presentation to you, but I've been extremely excited about being able to talk to you about this research, and I hope some bit of it got across, and I'll be looking forward to hearing listening to your questions and the ongoing dialogue. Thank you.